Hello and welcome. You're watching the Hindustan Times. I'm Abhishek Singh. We're coming to you from the sidelines of HTLS 2025, the Leadership Summit, which of course celebrates the journalistic contributions and excellence of Hindustan Times Group, which has a legacy of over 100 years. On the sidelines, I'm joined by some of the brands, which of course made this event possible and a grand success. Right now, I'm joined by Mr. K Gupta, Chairman, Felix Hospital. Mr. Gupta, thank you so much for taking up the time and talking to us, sir.
Thank you so much for having me here. Thank you so much. And lots of congratulations to all on this event. Great event.
Thank you. Thank you. So before we start talking about the summit itself, let's briefly, now that I have this opportunity and you're here with me, let's briefly talk about the healthcare sector, what's happening there. And of course, AI is something which pretty much every industry leader that I have been talking to since morning has been talking about. And of course, as far as healthcare is concerned, let's also briefly, if you could touch upon some of the government initiatives and what are your expectations from the government as far as the healthcare sector is concerned. What could be done there? What would you like to see done?
Great. I think healthcare sector in India is quite bigger one. We talk about the size, market size, it is around 500 billion industry and growing at a rate of CAGR of 22%.
Yeah.
And if we talk about for healthcare participation by private sectors, around 70 to 80% of the healthcare services, being it OPD, lab, diagnostic, radiology or indoor treatment, that is provided by the private sector only. But as a government initiative, India has launched world's biggest cashless insurance scheme, that is PMJY, Prime Minister Jan Arogya Yojana, that is Ayushman, and it is doing great. More than 35 crore families has been enrolled in this, and lakhs of crores of rupees has been invested on the treatment of the patient, and the patients has been provided secondary care, tertiary care like radiology, neurology, nephrology, cardiac surgeries, even neurosurgery, spine surgery. One of the most complicated treatment has been done through this scheme, and costly also. I think we are doing great, but definitely because this is a very high capex investment. If we talk about the private sector, and because 70% supply is from private sector only, and the dependency on the private sector is there for the government for next at least 50 years, because you cannot cover all these services through government hospitals because they don't have that bandwidth, that infrastructure. There is a lack of system, process, technology, infrastructure, skilled staff like doctors and nurses. There is lots of deficit gap in government sector. So B has to have something, PPP model, public partnership model, to provide affordable healthcare services to the forest, like the remotest area of the villages or maybe rural area of the India, because 70% of the Indian population resides in Tier 2, Tier 3 and Tier 4 cities, or even villages, where around we have only primary healthcare setup. We really need their secondary and tertiary care setup to provide services for some serious issues like cancer, medical oncology, surgical oncology, cardiology, neurology, nephrology that we talked about. These services are available in Tier 1 cities. They are not available in Tier 2 or Tier 3 cities, where we need to invest more. For that investment, we need help of private sector. For that, government should have some initiative, like it's a very high capex business. For one bed, at least 1 crore to 2 crore investment is needed to set up a hospital, and OPEX cost is very high, means operational cost is also very high. For making a hospital in break-even, it took around 5 years, minimum 5 years लगते हैं आपको break-even करने में.
In terms of cost, if you're talking about Tier 2 cities, in terms of cost, could you give us a ballpark, like how much money it would cost to build a hospital which is equipped with, all of these advanced treatments which might be needed in those cities? How much would it cost to build such hospitals?
For building a 100-bedded hospital in Tier 2, Tier cities, we need at least 100 to 150 crore initial investment for land, building, plant and machinery.
Okay.
And we need at least 3 to 5 years working capital, because it will be in loss for 3 to 5 years. For that also, around 20-25 crore. Means around 200 crore are needed for making a hospital profitable from start to making it break-even. 200 crore. For that, we need support from government in terms of subsidy, in terms of land, because most of the land given by the government authorities, that is also on auction or commercial rates only, and we don't have any subsidy in financing part. There is a same rate of interest has been given by banks to us and the other commercial players also. There is no subsidy. Even there is no subsidy on import duties, or there is no subsidies on initial losses, initial investment. I think there is lots of area where government can help at least initially about 3 to 5 years to private players so that they can be in break-even, and then they can remove that subsidy, and we can provide, with this method, we can provide accessible and affordable healthcare services to tier 2 and tier 3 cities.
Affordable being, the key word there. Because that's going to be very important for, people, of course, as you were saying, that a lot of India's population is in tier 2, tier 3 cities. And at the same time, I mean, we are aware of the income levels that we're talking about, especially in tier 2 and tier 3 cities. So making it affordable is perhaps what you're going to contribute in terms of, government is, of course, going to give you the subsidies if, as and when that happens. But your role would be to perhaps provide that healthcare at affordable rates.
And a great question, because we talked about the data. Around 5 years back, 62% of the Indian population was paying out-of-pocket expenses for getting treatment, and they were paying this money by selling their households or taking loan, selling their jewelries. Even I think this matter was raised 2 days back in Parliament also. Currently, that is reduced from 62% to 42% with the initiative of the government like Ayushman Bharat and other improving in the insurance penetration. Definitely. We as a private player already supporting government a lot. If we talk about the rates of Ayushman, they are 1/50th of rates if you compare from developed countries. Even the private insurance rates or cash rates in our hospitals are 1/10th to 1/20th are reduced from as compared to developed countries. So our healthcare is already very affordable, and we also have very, like the Ayushman scheme having very low package rate. Still we are providing services to these patients also. Definitely, because health is primary a right of our Indian citizens, and it's a responsibility of center and state combined, mainly states. Therefore, they should invest more on their GDP expenditure on healthcare. Yeah. The allocation of funds should be high, because we are investing only 2.5% of our GDP on healthcare sector. However, as per WHO guidelines, it is 100% recommended that it should be minimum 5%. And if we talk about the developed countries, those who were collapsing during the COVID period, they invest around 10 to 15% of their GDP. That means allocation of funds should be high. Already this government has done very good in last 10 years. Initially, 10 years back, it was around 1.25% only. Now it is doubled from 1.25 to 2.5 within last 10 years. I expect from government, and I request from government also, be as a healthcare industry leaders, we 100% like our request is that they should definitely allocate funds on healthcare budget. It should be at least 5%. Also, the healthcare budget, 90% of the allocation in healthcare budget is on curative part, means treatment part.
Right.
We don't invest much on wellness part, preventive part, prediction part. There is a lack of budget and lack of awareness, lack of education, and lack of centers also. So I think after COVID, there is lots of awareness among population, and we should utilize that, and definitely we should open lots of wellness center. Already government has started, but they have allocated only 5 to 10% budget. It should be around 30 to 40% of the total budget that should be allocated on preventive care, predictive care, and precision medicine.
In other words, it all boils down to money, and that is where, of course, both private sector and the government will have to come together and ensure that the kind of healthcare which is needed in India's tier 2, tier 3 cities gets provided. And now moving on, I quickly want to get to the last question, and that is, of course, about the Leadership Summit. What's your experience been so far, and what are you looking forward to?
I think this is a great event, and we look forward to this event every year, and I really congratulate Hindustan Times on completing 100 plus years in his great journey, and the speaker you choose, they are great, and they are industry leaders, being a politics, being a judiciary, being a business, or being any industry. They have chosen great speakers, and we are having great messages from them also, and definitely we will implement these learnings from in our system, in our ecosystem, may be institutional or may in the industry, and we will learn a lot, I think, in post-lunch session also.
Right. On that note, Mr. Gupta, thank you so much for taking out the time and talking to us. Thank you.
Thank you.